Hey guys, Dr Davin Lim, board certified laser dermatologist. Last week's video we did a quick review on how to treat skin pore sizing in someone of ethnic origin. So with someone of ethnic origin, I use a different device or a different method. Today's video will be covering how to treat skin pore sizing in general. Skin pores are basically divided into three types: small, medium, large. And each of them will have their own specific method of how I actually approach them. Okay, so the majority of patients, when they see me, they would have gone through all the DIY tips, all the skin creams, all the over-the-counter preparations. That's why they come to see me, because nothing else works. So they would have gone through their AHAs, their alpha hydroxy acids, their vitamin A peels, their glycolic acid peels. They would have had probably skin needling at home or by dermal therapists. So these patients, when they come see me, they have pores which are hard to shift, which means I use these specific methods. I'm not saying this is the only method that exists. If I were to cover the entire spectrum of how to treat pores, you'd probably fall asleep at 45 minutes into this video. So this is just a brief outline on how I treat small, medium, and large size pores. So guys, thanks very much for watching, and I'll show you how I do things. The first thing to do is categorize pores. Pores can be categorized into large, deep pores or ice pick scars. They can be categorized into medium-sized pores, and they can also be categorized into small, open pores. But in reality, most patients will have mixed pores with different size pores, small and medium or small to large. That is the reality of the situation. If you missed last week's video, it's the how to treat pore sizing in ethnic skin types. And with that, I use a pico laser, which is basically a fractionated Q-switch laser. Here you can see me, I'm having my pores treated. I've got small to medium-sized pores, and I had mine treated about 2 years ago. I had only, I think, 2 treatments in the end, but I'll show you before and after, after just 1 treatment. This is the treatment of choice for myself, my family, including my dad. My dad had 2 treatments, and very shortly you can see the before and afters in ethnic skin types. So here you can see me before with pores and later. So this is after just 1 treatment. Look at the difference in the size of small pores. This is my dad with small to medium large pores and elastosis. Can this be treated with Caucasian skin types? Absolutely, but they do need 2 to 3 sessions. So that is the pico laser. Okay, now let's talk about skin needling for pore sizing. The first skin roller was invented nearly 30 years ago, and it's still used now. It's called Dermarolling. It's extremely old. It's 3 decades old. It can stimulate collagen production. So in the upcoming months, I will show you DIY tips on how to skin roll. But if you're watching this video, chances are you've tried skin rolling and your pores are still present. So my advice is to go for something like a 0.5 to 1 mil. Now, the second generation of skin rolling is actually skin needling. We're using non-energy vertical microneedling, and that basically doesn't rip up the skin as much and can stimulate collagen much in the same way. Now, third generation devices include the ND-Med Intensive. We can adjust the pulse duration, the energy settings, we can adjust the depth, and we can do all of this in the machine itself. And it uses RF or radio frequency controlled energy to deliver heat, as in controlled heat to stimulate collagen. This in turn reduces pore sizing. Okay, so next week I will go through energy-based insulated vertically delivered microneedling devices. This is totally different, 4th generation, and what this does is it basically insulates the needle to deliver RF energy in a certain depth while insulating the outer aspects of the skin. So my favorite device is the use of Infini RF. In this setting, it's very complex because the insulation is, I believe, is not needed because it's only treating skin pores, which are only about 2.5 mils or less in depth. Most patients do need about 2 to 3 treatments. I often combine this with PRP. I'll be doing a whole segment on this next week. And it can be excellent to reduce skin pore sizing on the nose and small to medium sized pores. So excellent modality for small to medium sized pores. That's Infini PRP insulated microneedling. The next treatment we'll be talking about is contact radio frequency bipolar systems. These devices I think are overhyped. E-Matrix, E-Loss, E-Max. Everyone's got one. They're simple entry point devices, which means any consumer or beautician can buy one. And the energy control is extremely variable together with the techniques and contact points. I do use them. I like it for early acne and small to medium sized pores, especially if they're early on. And I'll show you a couple of before and after. So these are predictable. These are E-matrix treatments 1 month apart, before and afters. And once again, excellent for early acne scarring and small to medium sized pores. But that's all I use them for. I don't try to shrink late pore sizing in this at all. Fractional laser resurfacing is all the rage for the past 8 years or so. Many different devices, many different ways to treat. I stick to Fraxel. I quite like using the Fraxel in a 1927 wavelength compared to the 1550. Everyone would say, hey, 1550 is actually the better wavelength, or the 1440, but no, I do believe in 1927, both in the Premier with the Clear and Brilliant together with the 1927 original Fraxel. I believe in the super high density mode is the treatment of choice for pore size reduction, and I'll show you a couple of before and afters later. So the whole idea with this is not to follow the Fraxel guidelines, but actually do bulk heating. Now, if we're going for the big guns, we're looking at a CO2 Fraxel. So the CO2 Fraxel basically is a carbon dioxide Fraxel laser. It's great for enlarged pores due to sun damage. The downside about this laser is that the downtime following CO2 laser resurfacing is in the order of 10 days, and you will be red for 6 to 8 weeks afterwards. But it's great for sun damaged pores. I won't labor you with lots of before and afters. They can be found on my website link below, but this is Fraxel 1927, one treatment and one treatment only. Look at the pore size reduction, recovery time 4 days. Another laser I love to use is actually the Clear and Brilliant laser, which is essentially a Fraxel laser. For example, CNB or Clear and Brilliant is actually a Fraxel laser. So it's a mini Fraxel laser, which means it delivers 5 millijoules, a quarter of what a normal Fraxel laser can deliver. But the great thing with that is that is the ideal treatment for certain skin types, like my skin type or ethnic skin types, but also to treat certain conditions like melasma or pigmentation. And what it does is that it delivers fractionated laser beams into the skin, and that allows us not only to treat pigmentation gently, but allows us to actually infuse, and that's what I like, because we can infuse things like ascorbic acid, vitamin C, or collagen building peptides, for example, like copper peptide serums, and even fading creams. So that's the beauty about these lasers, is that they are soft, gentle, but they actually do work for the purpose. So I'll show you how it's done, guys. So this is the Clear and Brilliant using the standard protocol. Basically, it's 2 lines with a 20 to 40% overlap horizontally and vertically. This can be safe in all skin types, including ethnic skin types, all the way up to skin type 6. So very, very safe laser, and you can see it's a standard protocol of crisscrossing. I use this laser in a slightly different method, that's the bulk heat. How this laser works is to basically treat portions of skin, leaving untreated skin to actually heal up quicker. So it stimulates collagen production over time. What are the results like? Well, after about 3 to 4 treatments, you can see you can have a good pore reduction. So this leaves me with one of my favorite ways to treat really deep ice pick scars and big pores, and that's to use trichloroacetic acid, or TCA. Traditionally, the way to do this is to actually use a toothpick to actually dip and then dab. I actually like using a syringe delivery method. I find it quicker. I'm not injecting, so once again, I emphasize this, I am not injecting into the skin. All I'm doing is just dripping a tiny bit using osmosis to actually carry on to treat the pores. So I find that it's a much quicker method. And for finer work, yes, I do use a toothpick, but the majority of scars, I like using this method of a syringe delivery. So once again, not injecting, do not inject this. This is just a drip method. And once again, it's not an actual drip itself, it's just a tiny droplet which is carried by the next droplet by osmosis. So it works really, really well. It's very predictable. The skin heals over in 5 days. And so what are the before and afters like? So these are typical examples of scars treated after 2 to 3 treatments. You can see a marked improvement in deep scars. So you can see pores over here, large pores before and after. It really is a miraculous treatment, and it is very predictable. Once again, can treat large pores, and this is after just 2 treatments with TCA Cross. And once again, deep pores, upper lip, super easy to treat before and afters. So this is mixed acne scarring together with open pores before and then after 2 episodes of TCA. So you can see just after 2 episodes of TCA, no laser resurfacing, an improvement, a significant improvement. Once again, deep open pores before and after 2 treatments and 2 treatments only. A highly predictable response. Ablative laser resurfacing can also be used to treat pores, but remember that pores are often flask-shaped, so you actually have to go a lot deeper than what you anticipate. The healing up time for this procedure is about 10 days with redness that may pursue for even 6 to 8 weeks. So do I do this? Absolutely. Do I like using it as a first-line treatment? No, I don't. But it does work, and you can see with the before and afters, this can be a remarkable change in pore size reduction. So I'll show you a couple more before and afters for really deep pores, and fully resurfacing lasers can actually work very well in this setting. But like I said, we try to go for other lasers first. Guys, thanks very much for paying attention to that video. I hope that was informative. I do one new video every Saturday morning Brisbane time. So everything on lasers, on fillers, on procedural dermatology, and everything that's new or coming out in the near future. In the next few weeks and next few months, I'll be discussing things like DIY tips, for example, skin needling at home, discussing different types of skin needling, including first generation DermaPen, third generation intensive treatments, and all the way up to Infinity, and presenting some really nice cases for acne scar revision. So a little bit of mix here and there, and I'll be doing more DIY stuff in the next couple of weeks. Guys, really appreciate you watching this video, and I'll see you next Saturday. Thanks for that. Bye. If you're new to this channel, I also do some Instagram videos together with picture uploads quite a fair few times a week, mostly educational. So like I said, this is an educational based channel based upon laser dermatology, as well as what's the latest in skincare and skincare guides. So I'm on Instagram under Dr Davin Lim. Once again, thanks guys, bye.